This is Bishop Edgar Vann, and welcome. This is The Vantage Point, where I seek to inform, infuse, and inspire, raising a fresh and cutting-edge perspective to practical solutions for everyday life. I want to give a huge shout out and great commendation to my staff, also to Erica Terry, who is our Chief Health Advisor here, and to the Michigan Chronicle and Brother Hiram Jackson, and of course, most especially to our sponsor today, Henry Ford Health System, its CEO, Wright Lassiter III. Today, I'm excited to share information about the COVID-19 vaccine. We're having a community conversation today so that you can have at your disposal the latest information that you need and knowledge that you need in order that you and your family might make an educated and informed decision with regard to the COVID-19 vaccine. We're going to talk about the vaccine. We're going to talk about health disparities in the African-American community. We're going to talk about vaccine hesitancy and the sincere desire of us all to get past this pandemic, which has currently affected 100 million across the world, over 100 million, 2 million, over 2 million deaths in the world, 25 million cases in the US, and 429 deaths in the US as well. And now, with several mutations and variants that are coming from the UK, from Brazil, from South Africa, and beginning of now to reach the United States, in 22 states already in the United States, we wanted to have the opportunity to let you know how urgent of a matter this is for you to have all of the information that you need. There's a book that I read that says, "My people are destroyed because of a lack of knowledge." We want to make sure that our community is safe, our community is informed and apprised of just exactly what's going on with the COVID-19 vaccine. I have with me today, I'm so excited to have with me today a very, very distinguished panel of health experts. And in just a moment, you're going to hear from them, their perspectives on the vaccine, on the disease, on the pandemic, and its effect upon the African-American community. But I wanted to just introduce them to you initially so that you can know that I'm not on here by myself. I've got some great, great experts and people here to help me to help you. First of all, I've got Dr. Pamela Pugh. She's the Chief Public Health Director for the city of Flint. Dr. Pugh is a very renowned person, most especially in the public health and public policy health space. She was intimately involved, of course, in what we know as the Flint water crisis and the opportunity that she had as a health expert to help expose the kinds of things that were happening in the city of Flint as it related to our community and communities of color. I want to really, really welcome her. She has a doctorate in public health from the University of Michigan, but she's also has a bachelor's degree from an HBCU, Florida A&M University, for which my daughter is also a graduate. We welcome you, Dr. Pamela Pugh. I also have with me Dr. Lamont Jones, who, of course, is also a University of Michigan graduate. He's the vice chair of the Department of Otolaryngology at Henry Ford Health System. He is very renowned and chairs, of course, at Henry Ford, the cleft and the craniofacial clinic there. And I'm very grateful to have him with us. He's one of the emerging experts, of course, in our community with regard to health. I want to welcome Dr. Jones and welcome him from our Henry Ford Medical Group. Thank you, Dr. Jones. And then also I have with me Dr. Iris Taylor. She is a veteran of a health expert here in our Detroit community, having been a part of the DMC health system for her career of over 40 years. There, president of Hutzel, president of Harper, CEO of the system, CEO of the University Health Center, director of nursing. She has done it all. And now I'm grateful to have her on today because she is helping to operationalize the COVID-19 immunization center at TCF Center in downtown Detroit for the city's health department. Welcome, Dr. Iris Taylor. Well, I'm getting ready to get the opening statements from all of them. We want to find out, first of all, just what is the coronavirus? What is COVID-19? How did it get formed? Where did it start? Where did it come from? And I also want to explore the idea, of course, of vaccinations. There is a great deal of vaccine hesitancy in the African American community and communities of color. And we know that, and we know why. There are health disparities in the African American community that have been, and inequities in our system, our political system, our government system, and even, yes, in health systems that historically has given a lot of African Americans pause as it relates to immunizations and epidemiology. It's important for us to understand that in the context of the COVID-19 vaccine. But though we talk about the Tuskegee experiment in 1933, though we talk about other kinds of incidences where unjust, unfair, and inequitous things were done, we all know that all of us have benefited from vaccines. I remember just as a child, my mother had a mark on her arm over here. And in the summertime when she would go sleeveless, I would always ask her, "What is that on your arm?" And she would say, "Son, that's my vaccination," that she had gotten in her early childhood. All of us, many of us, especially baby boomer generation, we remember the vaccines for TB, for polio. We remember the little sugar cube that we took at school and how these vaccinations were required for school. We also know that we're a society that doesn't have to deal specifically with tuberculosis anymore, with polio, with smallpox, with yellow fever, with measles, mumps, et cetera, et cetera. Why? Because of vaccines. And a lot of people say, well, I have a hesitancy because I don't like needles. Well, listen, I don't like needles either. I do know that there are many, many African Americans who are diabetic, and many of them take insulin shots every day. If there was a conspiracy against African Americans, I suppose it could have come from an insulin shot. I'm not saying that in a threatening way, just saying that for us to have a perspective of understanding how vaccines have blessed us and helped us down through the years in terms of various kinds of health ramifications in communities of color. Well, I want to start with my panel. I'm not a health expert. All I do is read a lot. But I want to start with my panel because I'm very, very excited to have Dr. Pamela Pugh, Dr. Lamont Jones, and Dr. Iris Taylor with me today. Dr. Pamela Pugh, I want to talk with you about certainly the public policy standpoint of this. Some of the mistrust that people have that is absolutely justified actually recently comes from the Flint water crisis in terms of the trusting of government as it relates to chemicals and things of that nature. I'd like for you to just give us an opening statement, speak to the virus, speak to the vaccine, let us know what's on your mind.
And thank you so much, Bishop Vann, for just having this panel discussion. It is so critical at this time that we're in this crisis, and just to be a part of this distinguished set of panelists, and to those who organized, Rhonda Graves and Stacy, thank you all for pulling me into this conversation. And thank you for just letting me be me and talk about our community and some of the things that we're seeing in our community, and then wrap up with this discussion around vaccine. So in the conversations right now, if you're like me, for 4 years, I've slept with my TV on CNN News, but you're waking up to this discussion around vaccine, and can we get it out fast enough as the virus is mutating? We're talking about also, are our children ready to go back to school? Are we going to get back to this normalcy, especially given this boost that we've gotten with the new administration that has come on board and taken this up as a critical issue, and their number one issue. One of the things that I just want to point out is when we're looking at COVID-19, and I was just thinking to myself, so for so many, this disease, this pandemic has been an inconvenience. But when we look at the Black, Brown, Indigenous communities, people of color, this disease, we've had a front row seat looking at the deaths of community members, our community leaders, family members. I think it was the first week that this disease really got the attention that it received in March. And I lost an uncle and began to really see how the disease just goes through communities and through families, and how quickly it could spread, especially given how our community is set up. The fact that we're church-going people, church is in us, and that is life for us. And so letting go of that, but seeing how it was very difficult, and having to shift how we did that. And I just want to spend a little bit of time looking at some of the statistics. Like I said, I talked about the CDC study that was recently done for a community in Wisconsin that was 92% of white population, 10% poverty level in a rural community in Wisconsin, 1% Black. And so the conversation, $55,000 is the median income. So when we looked at that, when we heard that study and said, we're ready to go back to school, immediately many of us began to once again become concerned, because as we look at the data, as we look at the statistics, we're ready to get our children back in school, but we want to make sure that you're looking at these two tales of America. And so making sure that the data that you're giving us is accurate data, that's data that can be applied to me and us. And, so the limitations and the shortcoming in that study, to me, raised some discrepancy still in how we communicate to those populations that are hardest hit, and making sure that we're included in the data and in the studies that are going forward. Our children, when we look at the statistics, though the numbers have seemed to be low in comparisons to adults for children who contract the disease, as well as those who die from the disease, keeping in mind that children are not the ones that are getting tested typically. And a lot of times they're asymptomatic, meaning they don't show symptoms. So they're going to have lower testing rates. But when we look at those numbers, 78% of the children who die from COVID are of color, meaning that they're Black, they're Hispanic, they're of the indigenous community. And that population only makes up 41% of the children, the population of children. They only represent 41%, but make up 78% of deaths. When we look at the adult population, we know that African Americans nationally, that though the number is coming down, we're still around 2 to 3 times more likely to die of COVID. Here in Michigan, that rate has come down to 2 times. When we look at the state by age, what we call age-adjusted rates, that number goes up to 3 times more likely to die of COVID than white residents. We also look at our children and we look at adverse outcomes other than death. There is this multi-system syndrome in children that we're seeing, meaning that multiple organs are impacted. And I'm sure the doctors can talk a little bit more about that. But that number here in Michigan, 41% of those are Black children. Nationally, we see more Hispanic, more Black children that are succumb or have this effect. And we know that Bishop Vann, is some of the things that you've already mentioned. There are underlying issues, whether our children have higher asthma rates, and we can talk about things that can lead to that, and some of the issues that we've been talking about for so long as it relates to those rates. But when we talk about COVID, again, we're talking about things that we've been talking about for so long, whether it's unequal access to healthcare or overexposure to pollutants in the air, whether it's lack of policy or inefficient policy, not adequate policy to roll back the decades of racism and discrimination, whether it's policy that's not putting the right foods in our neighborhoods and helps to drive obesity. We in these communities are not surprised to see what we're seeing in our communities. So let's just speed up. I'll speed up. I don't know where I am in time. But when we talk about the vaccine, of course, we're getting over a huge hump. And now we're able to look to see where we are and what the vaccination plan was or lack thereof. And we see that there are very low. I've seen like 3% of the population, 16 and over, that have actually been vaccinated nationally. Here in Michigan, we've improved over the past 7 weeks. We were at 45, number 45. Which is low out of 50 states. Now we've bumped up to 20, but who's getting vaccinated is the question. We can see that across the country, 20 states have reported vaccination by race. And out of those 20 states, unfortunately, Michigan is not one. I understand that they should be getting their numbers in. I was surprised to see that we did not have numbers by race. But what we're seeing across the country, and anecdotally, what I can see from the ground and here, is that we're not getting vaccinated, though we are the ones most impacted by this disease. And to add, Bishop, to what you were saying, yes, there was hesitancy, but I really would say with about 98% of surety that this is really not an apprehension issue. It's an issue of access. I get calls from people, and I have no wherewithal or nothing that I can do, but who are looking for the vaccine now, ready to do their part for themselves, for their family, for their community, but there's not the access. And so I think that we really there was not a lot of thought given to how do we get to those communities that we thought would be apprehensive and would not want to take the vaccine. But I do see more, and I'll just give just a few statistics. So statewide, it's about 6,500 per 100,000 residents that have received the first dose. And I'm sure that my co-panelists will help me with these stats if they're off. Upper Peninsula, we're seeing upward of 18,000 per 100,000 people who are being vaccinated. When we compare that to Detroit, that has the most population in our state, that's around just a little over 2,000, about 2,500 out per 100,000. So you look at Detroit compared to some of these small counties in Upper Peninsula, and there's huge discrepancies. So again, I don't know, and I don't believe that it's as much an issue now of people not willing to take the test. I think that we were questioning, we watched as Black, Brown, Indigenous communities, we've watched the efficacy. We've seen that number has stayed at a good rate. We've watched to see if there are side effects, and we've seen that they're minimal in comparison to the risk of contracting the disease and spreading it. And I think we're ready to take the vaccine. I just don't think that the vaccine is available. I think that we have to improve our communication. I think that we have to be very diligent and very determined and very deliberate about breaking down these barriers, breaking down, rolling back these inequities, and pushing back and making sure that we're getting to those communities that are hardest hit. And I think that with the plan that Biden has put out, it's promising. There are some things that I've pinned about, talked about, and written about that I feel that are lacking, but it's definitely putting us on a path to go forward. And I think that some of the plans that have been put out by the governor will move us forward. And so now we just have to make sure that the supply is there and that we're targeting our hardest hit communities and putting all effort into doing that.
Thank you so much, Dr. Pugh. Certainly that overview and analysis is so critical. The data is so critical. Numbers don't lie. Lets us know just exactly where we are. Dr. Lamont Jones from Henry Ford Health System, I'm so grateful to have you with us. And, let's sort of start at the beginning in some of your opening remarks, if you would. What is COVID-19? What is a coronavirus? Where did it come from? How did it start? Why is it here? Why did it proliferate so greatly across the world, and most especially in communities of color? And of course, your other thoughts about the COVID-19 vaccine.
Yes, so thank you, Bishop Vann, for having me as a guest on this timely panel on a needed topic. I would first like to also add, I'm a HBCU graduate, also from the Xavier University in Louisiana. Yes. So I'll start with some overview about what the coronavirus is, and then I'll talk about some personal and medical experience with dealing with people that have endured the coronavirus. So the coronavirus disease, or COVID-19, is a viral infectious disease caused by a newly discovered type of coronavirus. So the viral disease is similar to what most people know about the common flu that can occur on a yearly basis. The COVID-19 virus spreads primarily through droplets of saliva or discharge from the nose when an infected person coughs or sneezes. Most people infected with the COVID-19 virus will experience a mild to moderate lung disease or illness and recover without requiring special treatment. However, older people and those with underlying medical problems like cardiovascular disease, diabetes, chronic lung disease, immune deficiency, and cancer are more likely to develop a more serious illness. African Americans, compared with all other groups, are more likely to contract COVID-19, be hospitalized, and die from disease. Poor social determinants, such as longstanding systemic health and social injustices, along with pre-existing health conditions, have created a perfect storm in this environment. Moreover, systemic racism in healthcare, systemic and in the healthcare system, and centuries of inhumanity have fueled fear and hastened hesitancy in African Americans to seek shelter in the form of vaccines, clinical interventions, and community resources. The resulting mistrust has caused some to endure COVID-19 symptoms and suffer the ill effects of new or chronic illnesses because they have avoided or delayed treatment. I personally know of people who stayed at home with chest pain and subsequently died of a heart attack or nearly succumbed to COVID-19. So what I was saying that, I personally know people who stayed home with chest pain and subsequently died of a heart attack or nearly succumbed to COVID-19 because they believed they were better off at home because hospitals were a place not to get help, but a place to go to die, and they rather do it at home. So please excuse me if I sound a little passionate about this, because I, like many of you, know firsthand social determinants of health, social injustices, systemic racism, and the impact of COVID-19. My wife and daughters, 15 and 11, and I all had COVID-19 in March of 2020. Our symptoms ranged from none to my wife getting severely short of breath after one flight of stairs. Thanks to God, we did not need ventilator support and survived. Unlike an uncle who spent a month on a ventilator and a month in rehab before coming home, or my aunt and cousin who didn't make it as a result of COVID-19. During the first wave, hospitals were overwhelmed literally and emotionally by the number and severity of those affected by COVID-19. Like most health systems, we at Henry Ford prepared to climb the hill. We donned PPE, we quarantined with patients and away from family. We asked more of ourselves and each other, only so we could give more to our patients. And unfortunately, like some of those patients, some of us paid the ultimate price. The best way to prevent and slow down the transmission is to be well informed about COVID-19 disease, symptoms, and how it spreads. Protect yourself and others from the infection by washing your hands or using rubbing-based alcohol frequently, not touching your face, wearing a mask, social distance, practice respiratory etiquette by, for example, coughing in your elbow. Stay at home and contact your doctor if you feel sick, and seek immediate medical attention if you have serious symptoms such as trouble breathing, persistent pain or pressure in the chest, new confusion, or inability to wake or stay awake. I know others on the call will speak specifically about the COVID-19 vaccine, but I would like to encourage you to get educated on the vaccine and to seek those you trust, such as doctors, pastors, teachers, and friends, to get your questions answered. My wife and I have both gotten the vaccine. I will end with this. As Amanda Gordon eloquently said, there's always light. If only we're brave enough to see it, if only we are brave enough to be it. My family and I have endured the same fear, anguish, and heartache related to COVID-19 as many on this webinar. I have made, and we have made a decision to move from the shade and to be the light. I encourage you all to be the light as well. Thank you.
Thank you, Dr. Jones, and how poignant that is, because you have a personal experience with your own family with regard to this. I don't think that anyone now can say that they don't know someone who's been afflicted with the disease, very close to them, or someone who has succumbed to the disease that's also very, very close to them or very, very well known. And so thank you, not only for your medical perspective, but thank you also for your personal perspective. Dr. Iris Taylor, one of the premier health experts in the city of Detroit, who has distinguished herself down through the years as a voice that we rely upon for expert medical direction and, of course, advice and counsel. Dr. Taylor, good morning, and would you give us your thoughts?
Good morning, Pastor. It is a humbling experience for you to invite me. Thank you so very much for being part of this conversation, which is so critical to us in this time. This is a very challenging time economically, a very challenging time as we look at maintaining our health status, our socioeconomic statuses, as well as a challenging time mentally for us to be stable. And so when you consider all spheres of that, any conversation that we can continue to have with each other to not only uplift each other, but also to keep us well informed so that we make educated decisions and informed decisions about our lives. And particularly, you have a Mayor Duggan, who is very concerned and invested in the citizens of the city of Detroit. And as a result, he has mandated that he has teams of individuals within his departments to ensure that we're doing the most possible thing that we can to provide access and to provide support to the citizens of Detroit during this time. Specifically with the administration of the COVID-19 vaccine, Mayor Duggan has executed a very aggressive team led by Hakeem Berry in setting up TCF. TCF, the former Cobo Hall, is a site for where, as the governor had issued her mandate schedule that is compatible with that from the CDC recommendation, we are all in 1A. And 1A has all of the vulnerable population, 65 and older. It has individuals that in the healthcare field, those that are providing care to the individuals in the vulnerable population. There's a whole scale. But you have a mayor who's so committed that he has expanded that somewhat in terms of being sure that educators and childcare workers and other individuals all have access to be able to come to TCF. And there's a phone number, and I'm going to repeat it a couple of times. 313-230-0505 that you call. It's a central scheduling system that will schedule your first appointment and your second appointment, because both the doses that we have, Pfizer and Moderna, both require that with somewhere within 3.5 weeks to 4 weeks that you have to come back for a second dose. So when you call, you'll get an appointment for both the first dose as well as the second dose. It's a drive-through experience. It's very smooth. It's fast. They have up to 27 lanes available for cars to go through. So it's very timely. The mayor has instituted this. If you're 65 and older and you bring someone else, that you both can get it. So you bring someone of 75 who didn't have access and you're 65, or you would also, in a buddy way, be able to get the inoculation at the same time. TCF is hours of operation are from 8 to 6. You can call and make an appointment, and then you can schedule yourself anytime between the 8 a.m. and 6 p.m. Monday through Friday. That is operational. In addition to that, there is a commitment to look in terms of outreach. So the other component or principle that the mayor is pushing is to see to it that those populations, such as those in shelters, those that are in senior living facilities, that as a congregant can't get to TCF, we have a strong outreach program where we're going to them and providing the vaccination to them as well. And that's going to continue. In fact, today at 2:00, the mayor has exciting news to look at an expansion of how he's going to reach his target goal to vaccinate the entire population of the city of Detroit. And there will be some conversations about that, because as we've looked at equity, as the stats have shown, we have a strong population of Black and Brown individuals in this community. We have the lowest in the amount of those who have received the vaccinations per 1,000 cases, including looking at, in particular, our vulnerable citizens. That's why we started with our allocation at 75 and have been moving back up towards the 65 age, so that we try to capture as many as possible, emerge as much as possible into the population. So I think that because we have a mayor who has a heart for the city, he is investing what's necessary to try to give equitable access to the citizens in the city of Detroit, for which at this point, that disparity is quite evident. In addition to that, there is plans to develop transportation as appropriate to the same vulnerable population, because as you look at the overall social determinants of health, we know that transportation is one of the major things. So when you say I give you access, but I give you access and you can't get there, then I really haven't given you access. And so there's a desire to look at how do we break the barrier so that access is equitable to all populations who each individually have different needs to be able to take advantage of the access that we want to provide. So we're looking at how our allocation occurs so that we have access to vaccines in a more aggressive, robust way. In addition to that, we're looking at being able to provide both at TCF and its maximum capacity, which is actually we could do up to 2,200 vaccines a day through TCF. And so it's about matching the capability, the desire from the population, and the availability of the vaccines. It's about woven all three of those elements together so that we can make that happen. Additionally, in an outreach perspective, we're going to reach out to and expand a little bit the definition of a vulnerable community, to be sure that we get some of the homeless that are congregated in hotels or congregated in other environments, that we can go to them as well and provide an opportunity for them to get the vaccination. So I think that collectively, there are multiple integrated parts with several people working in the background on a daily basis, sometimes 2 or 3 times a day in Zoom calls, to see to it that on the outskirts that we not only are accessible to people, but we do it in a customer-friendly environment so that they're comfortable in the experience that they have getting the vaccine. So that's where we are from an overall distribution. And in fact, today at 2:00, as I said, that there's a press conference that the mayor will be having to announce some exciting news about how we're going to continue to strive to that objective to provide equitable access to the COVID-19 vaccination.
Well, thank you so much, Dr. Taylor. You know, we see on national news stories so many long lines and inefficiencies and people being sent home and all that kind of thing. None of that has happened in the city of Detroit. Every person that I know that's been to TCF and every person that I've sent to TCF after they've received an appointment through the city of Detroit has been dealt with in a very efficient and effective manner. And it's taken a lot of the anxiety out for so many people to receive that. I'm bringing back the panel, everyone back on, because listen, we want to really deal in the conversation portion of this town hall meeting, this vantage point. We want to try to drill down on some of the questions that we've received that we'd like to have answered today, so that people are in a position to have all of the information that they need. Feel free to jump in wherever you may. I might direct a question to someone, but certainly if you have an opportunity or thoughts that you would like to share, I'd certainly like to hear them. I know our audience would like to hear them. Again, I want to take the opportunity to thank my staff again, to thank the Michigan Chronicle for assisting us in getting the word out about this. I want to also thank certainly the Henry Ford Health System that's been a great, great partner to the Vantage Point today in helping to get this word out to as many people as we possibly can. Well, listen, is the vaccine safe? Why should I trust it? We know the health disparities, the history we have with healthcare. Were there African Americans used in the trials of the vaccine, both Pfizer, Moderna, coming up, Johnson & Johnson, of course, and should we trust it? Somebody jump in. Dr. Jones?
So to answer the first part of the question, yes, there were African Americans in the trials. Is it safe? I would say yes. I think that there is rightfully a lot of attention on some of the side effects, those that are real and perceived. Most of the side effects are similar to what we normally experience with vaccines. And as you so eloquently said in the beginning, most of us don't really realize the benefit of having access to vaccines. And so I would encourage from my medical standpoint and personal standpoint, people that have the ability and access to get the vaccine to seek out and make it known that they want the vaccine, because those are things that will help support the infrastructure to make it available.
Great. Dr. Pugh,
I would concur. I would concur, Pastor, that it is indeed safe. And that if you look at the long-term effects of those residuals that happen after you have COVID-19 compared to a vaccination reaction, that the possibility of having long-term negative effects is very high if you contract COVID-19, as opposed to getting a vaccination that would help you have minimal symptoms or even fight off and not at all contract COVID-19 because you were immunized. So, and I can say that, yes, I'm not just saying it. I'm like the poet on the day of inauguration. If you say it, you do it. I did take the immunization process myself.
Okay, great. Dr. Pugh, there have been those who've said, if I take the vaccine, I'll get Bell's palsy. If I take the vaccine, I'll have a very negative allergic reaction. Speak to that, because we know that there are people who have different kinds of rare reactions to vaccines, as Dr. Taylor has spoken.
And I don't have the data on that as far as the numbers, but what I do know, as I was talking to different groups of people being engaged, the NAACP, but just really hearing African Americans and people of color saying, we just don't want to be the first ones out there to get it. We want to, we're okay with looking, reading the data, making sure the right people are at the table. And now we've looked at the risk to benefit, as Dr. Taylor has mentioned. And I will just continue to reiterate that I think people are ready to get it. Yes, there are those who have side effects. But again, when we look at the risk of contracting the illness and the outcomes, and we talked about those numbers being much more stark, for African Americans and those of color. We were here before, maybe in 2009, and I worked at the Saginaw County Health Department when we were going through H1N1, and we had a brand new vaccine. And at that time, I was not eager to get the vaccine, but I felt that as a person who, as Dr. Jones has mentioned, knowing what vaccines have meant for us as a country and our history, that as a whole, that I needed to be the first person to get out there and get it, and survived. And again, H1N1, we had a much better outcome. We had the vaccine much quicker. And now here we are. I've unfortunately not been able to get the vaccine because I get to work from my home talking about these issues. And so, and I'm not 65 quite yet. And so I'm eager to take the vaccine and helping others to make sure that they can get the vaccine. My dad just recently got it, and he put it on Facebook. And from that, so many other people were like, how can we get it? Where can we get it? I have friends, parents who just are eager to get it. Again, those who are of age, but also those with underlying issues. And so they're ready to definitely get the vaccine and have studied the side effects and looked to see that they're getting the disease outweighs the risk of the that benefit outweighs the risk of having a side effect.
I tell people all the time, there are three people you ought to talk to before you take the vaccine. Number one, you ought to talk to God about it. Number two, you ought to talk to your doctor about it, because your doctor has full history, has your history, medical history, and any kind of nuances that might be in that health history that could pose some sort of a negative or adverse reaction to the vaccine. And then I say, once you talk to God, once you talk to your doctor, then you need to talk to yourself. You need to have a good conversation with yourself and make a decision about this. This virus does not seem to be going anywhere. It's not going away. It is not going to disappear into thin air and evaporate. We are going to have to protect ourselves against it. But listen, let's talk a little bit about, the contraindications or the comorbidities or the chronic conditions that a lot of African Americans have, which also makes them skeptical about taking the vaccine. Many of them, and we know that in certain areas of medicine and certain areas of our health, we react differently. I mean, there are different kinds of things going on in our blood. A lot of people believe that when you take a vaccine, what you're putting in you is the vaccine in order that vaccine might build up an immunity to it. That is not the case in the case of the COVID-19 vaccine. And it's a mRNA vaccine. In other words, it's not putting the disease in you to build the immunity. And maybe Dr. Jones, you can speak to that, explain what an mRNA, and does that change a person's DNA as it relates to the vaccine itself?
Yeah, so that's a great question. So I'll first say I'm not a immunologist or a infectious disease, but I can tell you how I understand it. So traditionally, vaccines were made by taking the virus and weakening the virus so that it couldn't cause disease in a person, but the person immune system could be exposed to characteristics of the virus that allow us to identify it as a foreign object and then attack the virus. As technology has advanced, similar to the type of TVs that we were used to watching. And I joke with my kids how it's amazing how every year the picture on the TV gets better and better. And so using that same analogy for the vaccine, essentially what happens in the old way of doing it is that the body is exposed to parts of the virus that it recognizes as foreign. And then it goes through a process of developing proteins that fight the virus. So what the new way of doing vaccine is to introduce a script that the body could use to then create the protein on itself and skip the steps in order to more efficiently and safely be able to recognize the virus and attack it. Going way back, mRNA is separate from DNA. So actually mRNA is not that stable, meaning that it doesn't stay around for long periods of time. And that's the reason why, part of the reason why the vaccines that we have available now have to be stored in a certain condition, have to be given during a certain period of time, because mRNA by nature isn't that stable. And so there's no evidence that the mRNA is going to do any changing to our DNA. And DNA is what makes us who we are and separates, humans from other animals in the kingdom.
Okay, great. Now I've got a couple of real quick ones, and if you could give me some real concise answers, it'll be great. What about pregnant women getting the vaccine, Dr. Taylor?
Yes, it has been recommended by the Obstetricians Association that pregnant women should get the vaccine.
And what about a lactating mother?
I don't have any data about lactating mothers, so I'm not sure about that one. Doctor, are you familiar?
No, I mean, I can try to find out quickly. Let me.
Okay. And what if you want to get pregnant in the future? Say, for instance, you're looking to get pregnant this year. Should you take the virus?
Yes, they're saying that not take the virus. You should take the vaccine. Yes.
Okay, that's great. I want to also sort of drill down on the Pfizer versus the Moderna versus the Johnson & Johnson, which is maybe soon to come to the marketplace, and talk about the second shots. I mean, what if you miss your second shot? What if the second shot is not available? Are you still immune? What does the first shot do? What does the second shot do? Anybody can handle that.
I don't want to handle that because I think that probably Dr. Jones, and he's probably looking for something else. While you were doing that, I was going to say something in response to your prior response, and that is making sure that people who did get the vaccine know that they still need to follow the same precautions that they were using prior to getting the vaccine. I just wanted to put that out there and give you a little bit of time, Dr. Jones.
When you say that, you mean wearing masks?
Wearing masks, yes.
And why? But why?
Well,
I mean, we know we should, but why?
And I will give my part, and then I'll turn it over to Dr. Jones, because for me, and what I've been hearing and reading is it's more of being protective to others, because you can still carry the virus and you can still pass that virus on to others. And so I'll let Dr. Jones clarify that, because I think it's that you can carry the virus in your in ways that others can. It's not that it's being injected, but that you can come in contact with the virus.
The vaccine itself only gives you 95% efficacy in terms of coverage, so that if you contract it, it's just like the flu shot. You can take the flu shot, but you can still catch the flu. And in this case, we don't want you, even though you may have mild to no symptoms, to be a carrier to infect others. And then when you look at it's going to take time to get enough percentage of penetration within the entire population with immunization, that you need to then continue to wear your mask. You need to continue to social distance yourself. You need to continue to wash your hands, and you need to continue to be tested. Mm-hmm. And because the only way that we're going to know over time whether we have herd immunization, we have to be testing individuals to be sure that the virus is not still present and just in asymptomatic individuals.
Good. Dr. Jones.
Yeah, so all those things are true. So the gist of it is there are some people that get the vaccine, you create immunity against it, and you may not have symptoms, but there's still a possibility that you can have the virus circulating. And so continuing to heed the precautions are going to be important to continually suppress the spread of the virus through the community. And so those are things that we're going to have to continue to do for the near future.
Well, explain to me this whole idea of herd immunity. We've been hearing that concept, and I just want, I'm trying to break some of this down so that all of our broad viewership has an opportunity to understand. When we talk about herd immunity, we're trying to get up to 75, 80% of the population being vaccinated for the purpose of bringing us to a place where we'll be in an environment that does not encourage the spread of the virus itself. Tell me, if you will, what is herd immunity and why is it so important in the vaccine process?
Herd immunity is being defined as if we have 85% of all the people who live, let's take the city of Detroit. In the city of Detroit, we all have been immunized. We all have in our system where we have built up some antibodies that can either deflect or provide a lesser effect of the COVID-19. And to get to 85% of the entire population, then they're just saying it's a herd of people who now have the likelihood of not cross-infecting each other. Or if it does exist in our population, it's a very mild thing as opposed to as severe as it is in itself.
We saw that back in last March, April, May, when this sort of caught on, especially here in the outbreak in the city of Detroit, just like wildfire. Every day I was getting calls. Every day members of my congregation were being severely hospitalized. Every week I was having deaths inside of our congregation. And so the super spread of that we've been trying to manage that. But now we're seeing another threat toward the herd immunity that we know we're trying to reach, and that is the other mutations and variants, strains of this virus that are now beginning to grow and emerge and proliferate in the United States. I think the first one that was identified was in the UK, and then Brazil, and then there's a different kind in the continent of Africa, most especially South Africa. What are these variants, these mutations, and how does that even give us a greater sense of urgency toward this vaccine?
So I think just to make it a little simple, when we look at the virus spreading in the community, it's important to get it under control because the longer the virus is actively circulating, the more likely the virus can do what it naturally wants to do. It wants to survive just like we want to survive. And so there's adaptions that are done to allow the virus to live. Just like there are adaptions that we do as humans, but it takes longer because our life cycle is longer. So a virus's life cycle is shorter. The longer it's allowed to spread through the community, the more likely it can make a change that makes it better resist our own immune system. And so that's one of the reasons why the urgency of now is present in order for us to build up as many people that are immune to or have the immunity to fight off the virus so that we can prevent that from happening. And so these new variants are just saying that the virus has changed a little bit so that it's and these can be positive or negative changes. And in the case of these variants, we're specifically worried about the ones that have changed in a positive fashion for the virus to better survive. And so that's essentially why herd immunity is important, because the more people that can fight the virus, the less likely the virus is going to be able to spread through the community and continue to change and make it harder for us to mount a defense against it.
So the COVID-19 vaccine that we're talking about right now, the Pfizer, the Moderna, maybe soon the one dose Johnson & Johnson, I do want to speak about that in a minute. Is it going to be effective enough to ward against these mutants, or will we have to come up with another vaccine and people have to get vaccinated again? People are asking that question. What's the answer?
I think the answer is that we don't know definitively. We believe that the two products, Moderna and Pfizer, at this point has broad enough coverage to cover the current mutations. But just like the flu shot that we have to take every year because it's a variant different every year and we have to be re-inoculated for the flu, we don't know that if over time we're going to have a second COVID-19. I've not read anything in the literature from the scientists that assures us that that's definitive that we will not, or that it's definitive that we will. I think we're still learning about this virus and its capacity. And then as we learn more, we'll then be able to be more definitive about it. I refer to you, Dr. Jones. Have you heard any more?
No, I haven't. And I just got an update. So as Dr. Taylor said, the recommendations for pregnant women, nursing, and those that are seeking to get pregnant by the Academy for Obstetrics and Gynecology is to get vaccinated. I think right now this may be at odds with what the World Health Organization is recommending. So what I would recommend, just like you said, Bishop Vann, that you talk to your doctor so that you can make an informed joint decision about what's the best way to proceed with the vaccination.
Dr. Pugh, I really want to talk about those side effects, especially with the second dose of either Pfizer or Moderna, because some people are kind of okay or kind of thinking about the first shot, but they've heard horror stories about the second shot. As Dr. Jones has pointed out, everybody does not. I think I saw statistics said about 31% of the people that get the second dose have, some reaction, which would mean that 70% don't. But speak to that, because some of the fear is that, I don't want to take and if I get COVID, I don't want to go to the hospital because people are dying there of it. And they know of situations where a person started coughing, have a little short of breath. Next thing you know, they're in the hospital, nobody can see them, and they go into a severe place. The second dose, what should we say to people when we think about the second dose of the vaccine?
I think it goes right back. You've said it all. I think going right back to making sure that people are staying in touch with their doctor if they are seeing any symptoms that they're concerned with. With all vaccines, there can be some soreness, discomfort in the arm. Yes, with the second shot, there are some people who are seeing what I would say are phantom like symptoms of the flu or COVID, and the doctors can. Dr. Taylor or Dr. Jones can come behind, but what I've seen is that it does not last. It should not last more than a day or so. And so again, contacting your physician if that is the case. And I wanted to get in on the herd immunity thing, because there has been some discrepancy, because when some people speak about herd immunity, they're talking about getting immunized by actually contracting the illness. When we're talking about this herd immunity that we want to see, we're talking about this safer way of getting the vaccine and getting immunized through the vaccine. But there are some policy thoughts. There are some people who think that there is a way that the more people that get the illness just by contracting it, the better off we will be. And that is not true. That's far from the truth. And that is why we are here talking about the vaccine. And as it relates to the mutations, I totally agree with Dr. Taylor that we can't say yes or no on either side. But what we do know is that we're in a race against time. We need to get people vaccinated, or people need to stay from being in contact with or coming, risking being exposed to the illness as these mutations are moving about.
Now, let me ask you again, Dr. Pugh, because I know that one of your specialties is health and health policy as it relates to children and young people. Are schools safe?
I think, as I talked about, the study that came out yesterday or the day before, I think that it bears out that there are definitely factors, mitigation tools that we have at our disposals that can make schools safer. I'm not comfortable saying words like safe. I'm saying risk to benefit, but. When we look at our communities where our children in Michigan are 70% more likely, they're much more likely to go to a school or be in a district where we don't have the funding to take care of ventilation and other infrastructure issues. And we're not hearing enough about ventilation and how that is one of the most critical factors as to how this disease spreads. So if we don't have the infrastructure and the building safety, and we cannot talk about the ventilation, and in Michigan's plan yesterday, we just talked about the fact that we will be looking at ventilation. But we have to make sure that we also have the maintenance workers. We also have the ability to address these issues beyond just this pandemic. You can't just put a filter on a system and then expect that filter to be clean and safe. Just like with the Flint water crisis, we couldn't just test the water once. We couldn't just change the pipes and put filters on. We had to have a system that could go into perpetuity or forever. So when we talk about in-person schooling, there is rightful concern with children going back to school, especially when we're seeing that this mutation could cause our numbers to go up again. And I think that we have to get out of this thing of where we shut down schools, we shut down the economy, we pause and or open back up. Then we pause when we see deaths, hospitalizations, or teachers that can't show up in the schools. we have to deal with this critical infrastructure and these inequities that have been present and we've been talking about for far too long. And when we're able to deal with those, I think that that's when we can use words like safe.
I just want to add something to the second dose. I think it's important that we clarify or at least inform. So as far as the symptoms are concerned, it's important to understand that when they did the clinical trial, some people, they got the placebo, which is essentially no active ingredient, also had similar symptoms. The idea that you get 2 shots or 2 doses is not foreign. There are some of the vaccines that we get already that have 2 doses. And the third thing is the reason why we get more symptoms with the second dose is because the body has to create a certain level of response in order to help produce the immunity that we need. And on the second dose, there's a more robust protein response. I talked about the protein that the mRNA makes. And so when you have a higher load of protein, you have the symptoms, but it also helps you to be have a better response and develop a stronger, more robust immunity. And as far as pregnant women are concerned, from my understanding in the clinical trials, they were not included, which is not uncommon for a lot of other medications, and sometimes for whatever reason, pregnant women aren't included. And so the reflex is to say that it shouldn't be done in women when the reality of it is just it wasn't tested. And so from what I was told, theoretically, the mRNA vaccines, the way they work shouldn't pose a risk to the fetus. And that's the reason why the Academy of Obstetrics and Gynecology is recommending moving forward with vaccinating women and those that are lactating. That are nursing.
Well, let me, I know we have just about ran out of time, and I'm going to go back around and get expressions from you all. And I'm going to start with Dr. Taylor because I really want Dr. Taylor as the immediate past president of our Detroit School Board to give some thoughts with regard to our young people in schools. And then we'll go back around and get our final thoughts from everyone. Dr. Taylor.
In order to ensure that there is equitable access to an opportunity, a learning opportunity for our children, in-person school has to be part of that option. And so, yes, we have to take all the precautions, which is why the CARES Act money was distributed the way it was to educational systems so that you can put the appropriate PPE in place, that you can separate children space-wise, that you can have a rotating filter exchange process and do a ventilation check within the facilities that we know are old. But if you put the right precautions in place, put the right procedures in place, as I know happened in DPSCD, because I happen to be a healthcare provider, so we ensure that as we move forward in the reopening plan, that you can provide, quote unquote, an environment that is not a super spreader, and that you can say in common communication that it is safe for you to be in this building. It is as safe to be in that building that it is in walking into your homes or any other place. And the fact, because you're insisting, like we put teams to just go around from school to school to just look and see are they staying compliant with the procedure. If you build all that into the process, in some cases, it's safer than it is in walking into your home because you are encouraging the constant washing of your hands and you have dispensers all over the place. So I encourage folks to understand that you can make a decision that you want to homeschool, you want distance learning. We ought to provide that, but we ought to also provide an equitable access. And I believe we can do it in a safe manner.
Thank you so much. I want 60 seconds from each of you, and then we're going to close. I want to thank everybody for tuning in to this great conversation about the COVID-19 vaccine. And certainly, I think I'll give you the same advice I've given to others, and that is talk to God, talk to your doctor, talk to yourself, make your own decision based on the information that is there. God also created science. Remember, without him was nothing made that was made. So we know that there is a symbiotic bridge between faith and science as well. Wish I had time to get into that with you. Hopefully I can do that on next time. I'm going to hear from our panelists one more time, 60 seconds only. Dr. Pugh, Dr. Jones, and then we'll close out with Dr. Taylor.
You know, my dad uses the term, we've been here before. And so as African American, as people of color, you know, we've been at these very grave crossroads before where we've been hit the hardest. And so we're going to get through this. We are people of faith, and we know that we are. But you know, speaking to this issue of how do we get back to normal, we just have to make sure that we break down all of those former barriers to making sure that we have, that we're not being disparately impacted. We have looked at school buildings, and when schools were first going to go in, we put a pause on that, listening to teachers, listening to parents, and making sure that the governor and those at the helm of decision-making, State Board of Education members knew that we had to make sure that we do not go back to a normal that puts the rest of us, some of us, at a place where it's going to harm us the most. And so that is what we're doing here. And I thank you for this opportunity for having this conversation. And we'll continue to push harder to make sure that we see the changes that we've been long fighting for, that unfortunately COVID has unearthed.
Thank you. Dr. Jones.
Yes, so I would end by saying, you know, first, I think you said it well. Speak to God, and as I always heard growing up at the end of the sermon, you know, if you haven't accepted God as your Savior, or you don't have a church home, I would say speak to somebody that's an influencer in your life, and then speak to your doctor and yourself, just like you said, so that you can be well informed. And what we need to get through this is people brave enough to be the light. And I would just close with that.
Thank you so much. Close us out, Dr. Taylor.
I believe that as we continue to have this kind of conversation, that you get enough information to make an informed decision. And I would encourage you to get the vaccination, because that's my opinion, but you have to do what you feel is critical in your life. But more importantly, remember this: stay safe, wash your hands, wear your mask, continue to social distance, and continue to test to be sure that you, as part of the population, are not spreading COVID-19.
Well, you've heard it from our experts today on this COVID-19 vaccine community conversation. I've had the pleasure and the privilege to convene these experts, and for you to hear directly from the experts so that you are properly informed. Thanks again to everyone, to the Michigan Chronicle, most especially to Henry Ford Health System, for your support of this great forum. This is Bishop Edgar Vann, and this is The Vantage Point.